This video is about procedures performed outside the operating room or that require the use of the Safe Surgery Checklist, SSC, and informed consent. The aim is to ensure patient safety, prevent errors, and comply with WHO SSC, CBAHI, JCI, and Ministry of Health guidelines. Purpose is to standardize the use of the Safe Surgery Checklist and informed consent for all invasive procedures performed outside the operating room, including ICU, PICU, NICU, emergency department, radiology, and procedure rooms. Scope of this policy applies to all healthcare professionals involved in performing or assisting invasive procedures outside the OR. It is the responsibility of the physician performing the procedure, supported by the nursing staff, to ensure completion of the Safe Surgery Checklist, obtaining informed consent, written or verbal as per situation, documentation in the patient's record. Procedures outside or requiring safe surgery. Checklist and consent 1. Interventional radiology. Angiography, angioplasty, embolization, central venous line under fluoroscopy, drain insertions, biliary, pleural, peritoneal. 2. Endoscopy suites, gastroscopy, colonoscopy, ERCP with interventions, bronchoscopy with biopsy or stent insertion. 3. Minor procedure rooms, clinics, central line insertion, chest tube insertion, tracheostomy, bedside or ICU, joint aspiration or injection under sterile conditions, bone marrow aspiration biopsy. 4. Emergency department, emergency airway management, surgical airway, chest tube insertion, orthopedic reductions with sedation, exploratory procedures, for example, wound exploration, minor excision. 5. Critical care units, ICU/PICU/NICU, bedside surgical, tracheostomy, central venous catheter, PICC line insertion, invasive procedures under sedation, anesthesia. Key requirements 1. Consent, informed consent, written when possible. Covers nature of procedure, risks, alternatives, and patient agreement. In emergencies, verbal consent or implied consent, documented by physician. Safe Surgery Checklist adaptation. Sign in, patient ID, procedure, site marking, consent, allergies, risk factors. Timeout, pause before incision insertion to confirm patient, procedure, team roles. Sign out, completion check, specimens labeled, complications noted, plan of care. 3. Team involvement. Even in bedside ER settings, at least 2 staff, physician plus nurse assistant, should conduct the checklist. Any invasive procedure, whether done in OR, ICU, ED, or procedural suites, requires consent and checklist to maintain patient safety, prevent wrong patient/wrong site errors, and ensure accountability.